Welcome to the Public Health Action Curriculum for Teens, or PHACT. PHACT is a free, video-based public health curriculum designed for teens to learn about the public health issues that impact communities across New Mexico. PHACT was created by the University of New Mexico Center for Disaster Medicine and the Albuquerque University of New Mexico Medical Reserve Corps Unit. For general information and for updates, please feel free to visit our website at unmcdm.org. You can also find us on Facebook at facebook.com/Public Health Action Curriculum for Teens. Welcome to Module 4, CPR. Module 4 consists of 3 videos. What are the steps of CPR? What do I do if someone is choking? And what is an AED and how do I use it? By the end of Module 4, you should be able to recognize what an AED is and how to follow the directions to use it, recognize when someone is choking and what to do if they are, and understand how to perform CPR.
Today I'm going to be talking about AEDs, Automated External Defibrillators. The AEDs is a PAD program, which is a public access defibrillation. AEDs are everywhere. They're in schools, they're in police cars, believe it or not, they're in shopping malls, they're on airplanes. Everywhere basically you look, anywhere you see a sign that has a heart with a lightning bolt through it, you can find an AED. AEDs were specifically designed for people who didn't have any medical experience whatsoever. So anybody can use this device. Okay, so this is an AED, Automated External Defibrillator. This defibrillator is non-specific. This one is a product of Leerdal, but there are several AEDs that are out there. Some have an LED screen, some don't, some you just put on the pads and you use it, okay? You open it up and usually you'll have steps exactly how to use it. They will talk to you. It has a sound device so that way once you turn it on, it will say whatever you need to do next. They've done studies with 6th graders and 6th graders are actually able to use these devices without any problems. It tells you exactly what to do.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light. Analyzing heart rhythm. Do not touch the patient.
No one touching. Stand clear.
Shock advised. Charging.
Everybody clear?
Stay clear of patient.
No one's touching?
Deliver shock now. Press the orange button now. Shock delivered. Paused. Begin CPR.
Christian, what you're going to do is you're going to go ahead and open up the AED. Great. And now you're going to turn on the AED, which is on the button there. The second step is you're going to place the pads on the victim itself.
Apply pads to patient's bare chest. Plug in pads connector next to
There's a picture on the pad that tells you exactly where to place them.
Like that?
There you go. And now you're going to plug in the AED to the connector. And make sure that once you connect it, you stand clear.
Analyzing heart rhythm. Do not touch the patient.
You may want to repeat, I'm clear, you're clear, no one's touching.
I'm clear,
Shock advised.
Everyone's clear.
Charging. Stay clear of patient. Deliver shock now.
Okay.
Press the
Everyone's
orange
clear.
button now. Shock delivered. Paused. Begin CPR.
What you may see is the victim jolt for a second.
Okay.
That is an automatic response from the electricity being delivered to the victim.
Okay.
Don't be alarmed. Go ahead and start CPR once that happens. Hi. In this segment, we're going to talk about hands-only CPR. So hands-only CPR was developed because of the fact that nobody wanted to do mouth-to-mouth on somebody. Okay. So now what they've done is, the problem that we have is pre-hospital survival rate for cardiac arrests was very minimal. So what they've done is they've developed this hands-only CPR technique so that way you don't have to do mouth-to-mouth right away. So the technique of hands-only CPR is very simple. You assess the victim, see if they're not moving or breathing or anything. If they're not, then you start CPR. Very, very simple. So now what we're going to do is we're going to tap them on the shoulder. Okay, if we get no response, we're going to start calling 911. After we call 911, we give them our location, time, and situation. We're going to come back, we're going to look at his face and chest, see if it's rising. Once we notice that it's not rising, then we're going to start CPR. And the way we start CPR with compressions is we're going to lower half of the breastbone for adults, center of the chest for kids. You're going to place your weaker hand on the bottom, dominant hand on the top. Because what you want to do is you want to create that force, okay? You're going to press down all the way. 2 inches is what they recommend. So we're going to press down about 2 inches, okay? 100 times a minute. After a minute of CPR, okay, we're going to reassess, okay? Okay, Christian, the first thing that we're going to do is make sure that the scene is safe. Okay, scene is safe. Come up to the victim, you're going to tap him on the shoulder.
Sir, there's no response.
Okay, so the next thing that you want to do is you want to call 911.
Somebody call 911.
Excellent. The next thing that you want to do is you want to look at the face and chest, see if there's any rise. No, then you're going to have to do compressions. Your lesser dominant hand on the bottom, stronger hand on the top. And you're going to do at least 100 compressions. Okay, you're going to start going and at least 2 inches down. Okay, go and relax your hands. Relax your fingers. There you go. You don't want to suffocate your fingers. All right, so go ahead.
Good.
Okay. All right, so Christian and Montana, we're going to talk about the abdominal thrust. So the first thing that you're going to want to do is you're going to, say he's choking. You're going to want to, are you choking? Can you speak? You got to have somebody's permission to help. Okay, so he's not speaking, he's choking. So what you're going to do, I'm going to help you. So you're going to come behind him, you're going to find his belly button and one finger right above his belly button. You're going to use inward, upward thrust. Okay, all right. Just look at him and say, are you choking?
Okay. Are you choking? Can you speak? I'm going to help you.
So what you're going to do is you're going to find that belly button. Okay. Close your fist, put your hand over the other hand, inward, upward thrust. This part always reminds me of Mrs. Doubtfire. Here you go. Come on, work with me. Let's go. All right? Until one of two things happen. One, they spit it out, or two, they pass out. Okay? You try. So find the belly button. Good. Okay. Place your fist, place your other hand, and go ahead and squeeze. Good. Okay. Your victim is going to fall to the ground. They're going to pass out. Once they pass out, then you're going to call 911.
So if I can't call 911, I'm going to have someone call 911 for me.
Very good. Okay. So now you've called 911, or you've sent somebody to call 911 for you. You come to your victim. Okay. You're going to look at in the mouth to see if there's any object in there. Once you see the object, if it's too far down, then they don't want you to grab it. They want you to, if it's close to the teeth or next to the mouth, then you can place your fingers in there and pull it out. But if it's too far, they don't want you to do any blind finger sweeps. Okay? And once you do that, start doing CPR. Okay? Okay. So, let's go ahead and go to the ground. Okay? There you go. For your knees.
Well, thank you.
Okay, so you're going to peek in the mouth. Okay? Let's say it's a coin. All right? It's way too far down there, so they don't want you to do any blind finger sweeps, right? So, we're going to start CPR. So, when we do CPR, one hand over the other, stronger hand on the outside, weaker hand on the bottom. Okay? Go ahead. Right on the lower half of the chest. Okay, and you're going to go 2 inches down. And you're going to go 1, 2, 3. That's your rhythm. Go ahead. Very good. Okay, go ahead and stop. If they're pregnant, okay, you're going to do a chest compression. If you cannot reach your arms around them, you're going to do a chest compression. You don't want to put any pressure on the belly button if they're pregnant, okay? Okay, so after you do your compressions, you're going to peek in the mouth. Hopefully you've been able to clear the object. Once you clear the object, then you're going to check for breathing and circulation. The way you check for circulation is you're going to look around to see if they're moving. You're going to look around to see their skin color. If it's pale or normal color, then you don't have to worry. Turn them to the side, okay? You're going to turn them to the side in a recovery position so that way they don't throw up on you, okay? All right, so what I want you to do is do some compressions. We'll finish the compressions. You're going to look around, see if you see any circulation. No circulation. They're breathing. You're going to turn them to the side. Okay, go ahead.
And then turn them to the side.
Very good. In this segment, Montana, we're going to talk about babies choking. Okay? So the baby starts to choke. Okay? So you don't have to shake them and say, baby, baby, are you okay? You don't do that. Okay? What you're going to do is you're going to peek in the mouth to see if you see anything that they're choking on. If it's too far down, they don't want you to stick your fingers in there, any blind finger sweeps, or stick your fingers in there. So you're going to turn them over and make sure that you have control of the head. Place the chest on your forearm, okay? And then you're going to place the baby in your index finger and your thumb. Very good. Chest on the forearm and forearm on your thigh. Gravity is going to work with you. So go ahead and place it down. Very good. The next thing that you're going to want to do is you're going to do 5 back slaps in the center of the back, okay? Use the heel of your hand. 1, 2, 3, 4, 5. You may want to do a little harder than that, okay, because you're trying to jar something loose. Okay, so try it again. 1, 2, 3, 4, 5. Very good. Okay, it's okay. You're going to hold the head. Okay, you're going to turn them over. Okay, you're going to peek in the mouth again. Maybe you jarred it loose. Maybe you can grab it out. If not, back to forearm, forearm to thigh. Okay, one finger right below that nipple line of the baby. Ready? 1, 2, 3, 4, 5. Okay, peek in the mouth. If the object hasn't moved, you're going to go back to the 5 back slaps. Okay, make sure that you have control of the head. Let's do this again. Okay, hold back, hold the head, hold the baby's head, hold the baby's chin, Turn them over. Remember, hold the chin. Okay, very good. Turn them over. Very good. This is very important because the heaviest part of the baby is the head. Okay, then you're going to do 5 back slaps again. 1, 2, 3, 4, 5. You're going to hold the head, turn them over, back to forearm, forearm to thigh. Good. You're going to do peek in the mouth. 5 chest thrusts. 1, 3, 4, 5. At this point, hopefully the object has come loose and you're able to pick it out of the mouth. If not, you're going to carry the baby to the phone, or if you have a cell phone with you, you're going to call 911. Okay? A few things I want to talk to you about is protectiveness and some devices that you can use to protect yourself. First of all, gloves, very important. If you have gloves, use them. You want to protect yourself from blood. You want to use gloves, any kind of protection for that. The reason is because blood, you don't want to get blood into your system. You want to protect yourself from any kind of bloodborne pathogens, bloodborne diseases. Some of the diseases that you can get are HIV, hepatitis. You want to protect yourselves from those bloodborne diseases, okay? It could enter through your eyes, it could enter through your mouth. That's why you want to use barrier devices, okay?
Why should we learn this, and why is it important?
Well, because pre-hospital cardiac arrest is very minimal, okay? People don't survive from cardiac arrest usually. So it is important for us to learn this so that way your grandmother, your grandfather, any family members or any friends that have these situations where they're in cardiac arrest can survive or have a better chance of survival. Young adults like you are starting to learn more and more about, and especially in healthcare fields, about CPR and about first aid and about all these things that they can do to help prevent somebody from not surviving these kind of things.
Are there any classes I can take to learn more?
Absolutely. Just remember that this is not a certification class. This is more of an awareness situation. But yes, if you want to go to the Red Cross website, if you want to go to the American Heart Association website, if you want to go to ASHI.com, you can find out more about some of these classes that you can take on your own. So for the most part, I challenge you to sign up for a class in first aid, CPR, wilderness first aid, wilderness first responder, so that way you can actually go out and save a life.
Congratulations on completing Module 4. The action step for this module is to bring Project HeartStart to your school, place of work, or community organization. Project HeartStart is free training for all able individuals to perform compression-only CPR. Start by finding a teacher, mentor, or adult who is willing to help you organize a Project HeartStart event. Gym teachers or school nurses may be a good place to start. Plan a time to visit the Project HeartStart website together. Involve your friends in the process as well. Project HeartStart is a wonderful opportunity to learn and practice CPR. For step-by-step instructions on bringing Project HeartStart to your school, work, or community organization, please visit projectheartstartnm.org.